All right, so now let's do a butterfly effect. So how did you get here? How did you get to VUCA?
Yeah, so it's funny. I was a student and interned at VUCA when I was in pharmacy school. So David Medvedev is the original founder of the company. And back in 2012, 13-ish, when they were just getting started up, they were looking for students to help start creating the library of the content. So they sent an email out. I went to University of Florida out in Orlando, the Orlando campus, and they sent an email out. Literally 4 people responded to that email, and I was one of them. And the requirements were you had to be a student, you don't have to read. So I was like, check that box. And you know, the job was you can work from home, you can create content, and I was a student. So you're telling me I can learn, and then you'll pay me to learn something. It was just a great opportunity for me, and that was my introduction into VUCA. And then, fast forward, 3 years ago, David left to create Aspen and wanted to bring in a new team to kind of run the operations, which was how I kind of got my role there. But as a student, I was really passionate about community pharmacy in pharmacy school. I started off with Target. That's where I kind of got my first kind of official pharmacy job as a first year as an intern there. Worked with them until that transition over to CVS, and then I also worked with Publix pharmacy. But community pharmacy was like a passion for me, and I started to kind of hone in on patient education, which was an interesting fit for me because I was a terrible high school student. I mostly did sports.
We got the football player thing.
I played football. I wrestled. Wrestling actually became one of my main sports at some point. But I was very competitive, but the academics thing just wasn't there for me. Barely graduated high school, let me tell you. Barely got into FIU, which is where I did my undergrad. But when I got to FIU, the competitiveness shifted over to saying, okay, this is now the game. The game is getting in, becoming a pharmacist, getting into a good school, getting a good career. So that because of that game sense and the competition of me kind of drove to where I am now. But the reason I kind of bring up me being a terrible student is I had to make a lot of complicated things very simple. And it took a lot for me to, whether it was physics, whether it was organic chemistry, just figure out ways to communicate these things simply and effectively. And what I started to realize was throughout pharmacy school, patients that were dealing with health issues were dealing with very complicated situations, and they weren't getting the education put to them simply and effectively. And I started to realize that that's my fit. That's exactly where I need to put my energy towards. And community pharmacy for me was the best place to do that. And then also kind of coming into VUCA was also a way to kind of expand on that and make that a much farther and greater reach. So I think that's kind of the kind of different pathways that kind of led me to VUCA now.
Interesting. So some of the stuff that VUCA puts out, right, with your, I guess, the counseling companion stuff with the QR codes, how does that play with, a chain retail pharmacy? I worked in a chain retail pharmacy, and aside from me and a handful of others, there wasn't a lot of counseling going on. Was that part of the driver of what you guys are trying to develop as well?
Yeah, one thing that we did not want this to be was a replacement of that counseling. We did try to mimic the counseling. We wanted to be, when a patient opens a video, we want them to have the feeling of they're talking to a pharmacist. But the goal was never to actually replace that or to serve as since you're not going to counsel, just give them this video. But what I think one thing that we did realize was important was that trying to counsel patients at a pharmacy or even at discharge, let's say in the health system space, is actually not the best time to try to counsel them. You have to do it obviously legally, and you have to still try your best to. But at the end of the day, patients, when they're at the pharmacy, they're usually in a rush. They're usually either on their way to work or on their way back home from work. So, they're trying to get home. And it's about what sort of education do they have now when they're home and on their own time and when they're most comfortable and ready to consume that content and that information whenever they want to. And that was the intention. The intention was really to be able to provide education to patients when they needed it on their own time in a way that they can simply understand and take action on.
So Josh has been in his position, deals with a lot of different state pharmacy organizations. And he was bragging on, he was like, one thing I know, Richard's somehow he convinced 50 states to do this. He said, that's an amazing feat.
Yeah, I was like, that might be the most impressive thing that VUCA's done, is get 50 states Board of Pharmacy to actually agree on one thing.
Yeah, and let me tell you the challenge of that is it took literally, I think, 7 years. If you start from like the day one, like this is when we're going to do this, to last year, I think we got our last Washington, D.C., technically not a state, but part of that. They have their own Board of Pharmacy. It's such a long process. The way that we did it was different for every state. Some states where we did it through an email. Some states we had to fly to the actual Board of Pharmacy meeting with a PowerPoint presentation, present, then answer questions, then possibly come back if someone else had like another question. So the process for that was intense. But the crazy thing is that in this day and age, it doesn't make sense that pharmacies are required to print paper and hand it to a patient. And what's really interesting too, and what also made it a little easier, although 7 years was a lot of work and a lot of time it took to do this, was that most of the regulation actually doesn't say that you have to print paper and hand it to the patient. Most of it actually just says that you have to just give it to the patient or make it available to the patient, let's say. So a lot of times we were mostly just saying, hey, we just want you to know that there's new technologies available now, and we're beyond having to use paper for everything. And your regulations actually doesn't specifically say that. So that made it easier as well. I think whoever was drafting these laws, which a lot of them are kind of copy and paste and use across different boards, whoever drafted that for some reason did kind of leave it open to the potential of technology coming into play. But we still wanted to make sure we crossed our T's and dotted our I's and went to these boards and make sure we got that confirmation from them.
Right. Well, and and another long time coming thing that it goes is like, a lot of the stuff revolves around a QR code, and historically the United States has been poor users of QR codes, right? Like South Korea, everything's got a QR code. Here, not so much. But COVID drove that to an absolute extreme, right? Like everything's got a QR code now. Have you guys seen some uptick on people using and scanning the QR codes more frequently now than say a year ago or a year and a half ago?
So there has been not only an uptick with utilization from patients, but just more people wanting something like this. Like our customer demand actually grew a little bit for people wanting. And what also made it much more easier for us was our need to not explain how a QR code works. That was a huge barrier for us as well. Before the pandemic, was one, explaining what a QR code was, and then letting them know how it worked was a challenge. But you're right, especially some of the Asian countries, like I visited Japan before, and the QR code technology is everywhere over there, and you can see how we're behind. And what I think also did us a disservice, I don't know if disservice is the right word, but what also just wasn't helpful was that when Apple introduced the QR code technology into their camera, they did it like in secret, borderline. Like they didn't tell anyone.
Yeah, like one day it just
this
worked.
has been available for so long. And a lot of people didn't know that you can just open up your camera phone, hover it over a QR code, and then the little link pops down. But for some reason, I guess Apple just was not keen on making that like a huge marketing push. So a lot of people didn't even know that they had the capability of scanning one. So that also made it easier. But yeah, I mean, there's been a huge uptick in not only utilization, but demand for it. And I think it's just easier now that when people go to restaurants, they're used to a QR code for their menu. And now it's slowly becoming the expectation for people that are getting their prescriptions. They want, can I get more access to something very easily? And the way to do that would be through a QR code.